Imagine you're riding in a car with your friend and their young child. You buckle your seatbelt and they buckle theirs, but the kid is left unbuckled in the back seat. "Hey," you say, "don't you think your kid should be buckled up?" "No," replies your friend, "I don't let my kids wear seatbelts." This surprises you. "Why?" you ask. "Haven't you seen the news? If we get in a crash, seatbelts can cause injuries. They can bruise your chest and abdomen and even break your ribs if the impact is strong enough. I'm not going to risk that with my child." "That doesn't make sense," you reply. "If we get into a crash and he doesn't have a seatbelt, he could die. Wouldn't you rather your child alive?" "I'm not going to argue this with you," your friend says. "You wouldn't understand." This argument, albeit strange, is a perfect analogy for the debate around vaccination. Parents who don't vaccinate argue that vaccines like the measles, mumps, rubella vaccine can cause autism or other adverse allergic reactions. While neither of these arguments are true, online communities and false news sites perpetuate these ideas that only endanger the population. Vaccines exist to create herd immunity. The concept behind herd immunity is that if most healthy people receive a vaccine, making them immune to an illness, those who can't receive the vaccine due to a poor immune system or young age will be protected because everyone around them is unable to spread the illness. It works both ways because even if that person catches it, there won't be an outbreak because everyone else is vaccinated. But for herd immunity to work, 80 to 90% of the population must be vaccinated. You see why it's an issue if less people vaccinate? Dr. Elizabeth Scott at Simmons University was able to give me a bit more insight on the long-term consequences of having an unvaccinated population.
Long-term consequences would be absolutely disastrous for us because we would be completely vulnerable to infectious diseases that we just haven't seen for generations. And we would just see massive illness and death, particularly among the most vulnerable people, the very young, the very elderly, and we would potentially be in a situation where an outbreak could just wipe out a whole community.
The Centers for Disease Control and Prevention says the nation is facing its largest measles outbreak in 5 years.
One of the diseases we can protect ourselves against is measles.
So measles, mumps, rubella vaccine, really safe, really effective, and that's the best protection we have.
Between January 1st to April 26th of 2019, the CDC has recorded 704 individual cases of measles in 22 states. This is the greatest number of measles cases recorded in the past 25 years, especially since the disease was declared eliminated in 2000. The MMR vaccine is generally completed by the age of 5, just before children enter school, but because of a rise in anti-vaccination, measles has resurged. The state of New York has declared a public health emergency in April due to an measles outbreak, mandating vaccinations and fining parents who chose not to vaccinate. It may seem like anti-vax parents are completely ignorant in their decision-making, but they've done their research with their own resources. With the way Facebook and YouTube algorithms work, most people only see posts that align with their views. That's part of the reason why so many anti-vax communities flourish online. Groups of people parroting the same information and sharing the same articles, never branching out from their community, will develop a belief system devoid of fact. If you saw a new article every day about people being attacked by their cats, eventually you'd believe that cat attacks are on the rise and that cats are violent animals. It's the same thing for anti-vaxxers. When an article that covers a once-in-a-blue-moon case of a child having an adverse reaction or a scientist making a mistake, that makes up the meat of the news people in anti-vax communities are seeing, allowing them to believe that vaccination is truly harmful because, hey, they're seeing news about it every single day. At the end of it all, having a baby is a big deal. Most people just want to do what's best for their child, and the combination of fear and misinformation is what leads people to be against vaccination. The problem is, their beliefs have immediate consequences for the population.
Well, the short-term consequences are also serious. We're going to see outbreaks of infectious disease that we haven't seen for a long time. And I think it's just a tragedy that people are becoming exposed to diseases that we know how to protect ourselves from.
We don't want children or adults to be unnecessarily exposed to measles because there are serious consequences to that.
Measles is actually one of the most, if not the most, contagious viruses that we know about. The statistic that's thrown out there is that if you take an unimmunized group of people and you expose them to measles, about 9 out of 10 of them will become infected.
Things shouldn't have to get to this level, and people shouldn't be getting sick from an illness we can protect ourselves from. So, what can we do? Firstly, the spread of misinformation has to come to a stop. Many people get their news from Facebook, which isn't always reliable. There are plenty of resources for new and expecting parents to learn about vaccination and how to protect their children.
So I can recommend, for example, if you go to the CDC, if you go to the NIH, Children's Hospital of Philadelphia has a wonderful website that's just great for parents who want to understand better vaccination. And World Health Organization is another resource. All of these organizations have great resources. They have both a scientific pages on their websites, but they also have places where the general public can find a lot of good information.
It's the responsibility of websites who notice communities spreading misinformation and fear to shut it down. Etsy, for example, no longer allows anti-vaccine merchandise or vaccine substitutes to be sold on their site. On a national level, governments shouldn't wait until an outbreak to mandate vaccination. The only people who should be exempt are those who physically cannot receive vaccines. Herd immunity is a service to those people, and there is no harm in vaccination. Finally, I'd like to say, many videos implore their pro-vaccine viewers to debate with the anti-vaccine people in their lives. Let them know how dumb they are. But I'm not going to tell you to do that. I just want to introduce Ethan Lindenberger, the 18-year-old who testified before Senate in March 2019 after educating himself and getting himself vaccinated, although his mother is anti-vaccine.
What are you going to tell Congress today?
I'm just going to share my story, talk about the importance of accurate information and the dangers of misinformation and how that applies to my life.
Ethan states over and over again that his mother is not stupid but misinformed. Your anti-vaccine family members, classmates, and coworkers are capable of the same level of critical thought you are, and nobody likes to be treated like an idiot.
But you people still won't listen.
Provide them with the correct information, and if they choose not to believe you, then that's it. You've done your part to dispel misinformation. It's up to them to change before it's too late.